talking about the superior and inferior laryngeal nerves. The inferior laryngeal nerve is also known as the recurrent laryngeal nerve. And that nerve has different structures that it is associated with based on if it's on the left or right side of the body. So we have two inferior recurrent laryngeal nerves. One's on the left and one's on the right because we have two vagus nerves because we have two sides of the body. So that left recurrent laryngeal nerve is going to wrap around a structure, and so is the right. And that left recurrent laryngeal nerve is going to wrap around the aortic arch. And that makes sense because the heart sits on the left side of the body, and whenever the ascending aorta and aortic arch and the continuation of that, which is the descending aorta, both thoracic and abdominal regions, comes off of the heart, it arches towards the left side of the body. Therefore, the left recurrent laryngeal nerve, which is off of vagus, can wrap around that aortic arch. Now, on the right side, we don't have an aortic arch. So it would kind of seem logical to hypothesize that the right recurrent laryngeal nerve would wrap around something like the brachiocephalic trunk or the brachiocephalic artery, which is a direct branch off the aortic arch. It's actually going to wrap around the right subclavian. And the reason it wraps around the right subclavian rather than the brachiocephalic trunk is just because that subclavian artery is a little bit more lateral, and it's a branch off that brachiocephalic trunk along with the right common carotid artery. And just because it's lateral isn't the reason, but based off the orientation of the body and the pathway that the nerve runs, it's going to be the subclavian artery.